Okay, so I'm obviously here to talk telehealth as well, but hopefully I'm not going to repeat what Leslie has said. What I'm going to talk today about is around integrating telehealth into your general practice and some of the things that you need to actually think about, and obviously managing the change that video consultations present for people. I'm also going to talk about some of the opportunities for residential aged care facilities and some of the opportunities there for telehealth. I will cover off Skype. It is a question that we get a lot about, and the college has actually put out some advice on Skype, so I'll run through what that is. And then I'll obviously just go through our resources as a bit of a blatant plug for all the work that we've been doing over the last 12 months. So first off, video consultations are a really different way in which we care for patients, and it's around using technology which some people aren't necessarily familiar with. So when you're actually going to be thinking about making those changes, you need to think about what is the good things, what are the benefits of actually making the change, and you need to think about how you're going to overcome any resistance to change. Whenever you want to do something new, it would be great to be able to come in and say, hey, let's do this today just because we can, but it's not always that easy. Change is about educating people around how things are going to work. It's about getting people to the point where they're comfortable and accepting of the change, and then it's also at that point where they're able to actually embrace that change and work with it. So don't be scared of resistance. Just make sure that you put things in place and that you've got those answers to the questions that people will have so that you can start to break down that natural resistance to change. To start making the changes that you want to around telehealth consultations, you need to think about what the changes are going to be. So for telehealth, you need to think about things like, well, what hardware am I going to need? So some of the things there might be, do I need to go out and buy a whole new range of hardware, or is it as simple as adding a webcam and a speaker to some hardware that I've already got? You also need to think about what the positives are. Now, Leslie talked quite a lot about those. So it's what are the benefits for the patients? Number one, they don't have to spend a lot of time and money travelling really long distances. And for your GPs and your practice nurses, it really is about that ability to interact with the colleagues. I think too, for patients in particular, most patients will go to their specialist and then they come back to their GP to find out what exactly that specialist consultation means for them. So having everyone in the room at the same time means that any patient concerns can actually be addressed really quickly and in a timely manner with the patient there. So it really does connect the whole patient's healthcare team as well. And the other thing is to think about the concerns and to be sensitive to those concerns. So with telehealth, some of the things are going to be, for your staff, oh my God, what if it doesn't work? How am I going to coordinate everyone to be in the room at the same time? And for patients, it's going to be around about, oh, how am I going to get billed for this? Is this the best thing for my healthcare? And do I really want to be part of that? So once again, it's being able to say, well, these are the answers to those questions so that you can actually make people feel better about the changes that you're wanting to make. So one of the things, and I won't cover off this in a lot of detail because Leslie did talk about it, is that once you've made the decision to move towards video consultations, to get your patients and your staff from where they are currently, which is offering you traditional face-to-face physical consultations and a referral where people travel to the specialist, to get them to the point where they're actually using telehealth, a video consultation coordinator is the best person to have to do that. They really become that central contact point. They make sure the appointments are coordinated, they make sure that the patients are informed, and they basically get the job done so it runs as smoothly as it can on the day. Really important is understand the equipment. For most people, they wouldn't have used video conferencing before, and for some people, they wouldn't have even necessarily used the hardware that you've got before. And one of the things that we suggest is prior to actually having a patient involved in your consultation, actually get your staff using it. Put some of them in one room and some in another room and get them to run a video conference, or get them to run a video conference with another organisation or a practice that they're dealing with, because number one, they can then see what the benefits are and how it will work, and it gives them an opportunity to become really comfortable with the technology. The next thing is provide information to your patient well beforehand. I've heard of incidences where patients have walked into a room and they haven't actually realised they're having a video consultation. So make sure that they know that that's what's happening. talk to them about the things to expect, get them to arrive at the appointment early, and give them some information that they can take away. We also have a great information brochure for patients, and you can adapt that to use in the way that you need to. And prepare to troubleshoot. No matter how much work you do, no matter how much time and effort you put into making things work, there will be a time when it simply just doesn't. So make sure you've got those contingency plans. And I think the lady up the back mentioned that one of the things that they've done is that they keep the video conferencing for the for the video content, and then use the phone for the audio content. Often actual troubleshooting is as simple as that. And once again, with your video consultation coordinator, they've probably set up some really good troubleshooting guides that people can use as well. And sometimes it's as basic as, the webcam or the speaker's not plugged in. So don't think it's a really big problem to start with. Go for the simple solutions first, because they're often the ones that work. Question?
Joanne, we have trouble keeping to our appointments time. So is that an issue, coordinating appointment times at two different sites?
Yeah, look, it can be. Obviously, it's very rare for people to run to time in terms of their appointments. So what we recommend is that you get your patient there 15 minutes early. They can actually get set up, get started. Your consultation coordinator can then test all of your equipment. And then if the specialist comes online and you've got your practice nurse with them, you can start some of the process of the consultation, because as Leslie mentioned, your GP doesn't have to be in the room for the whole time. So someone can do the introductions, do the ID checks, make sure you're talking to the right person, and then when the GP's running back to time, they can then come into the room and finish up the consultation. It is about being a bit flexible, and that comes down to some of your troubleshooting as well. You're not just troubleshooting technology, you're troubleshooting some of those day-to-day things that come up where you go, oh my God, I'm so running late for that consultation, or your patient's car breaks down and they can't get there. So think about some of those contingency plans as well, because technology is great, but you've got the human factor that's part of that as well. And the best laid plans of mice and men don't always work the way they should. So, I think I've just gone back the other way. That's better. So basically, when you're making those changes, really think about what you need to change and the best way to change it. And if you do that and you do it with a really positive outlook and in a way that really reflects the benefits, really, you can't go wrong. With residential aged care facilities, I just want to touch on those briefly, because what we're finding at the RACGP is that a lot of residential aged care facilities aren't aware that they've got incentives available to them as well. Patients in residential aged care facilities often have multiple chronic illness issues, and it's really difficult for them to actually get out of the residential aged care facility and go and see a specialist. And most specialists and GPs are already visiting residential aged care facilities as part of their normal day-to-day business. So with residential aged care, they can be located anywhere in Australia. They don't need to be in a specific geographic area. And essentially all you need to have is either your GP or your practice nurse with the patient at the facility, and then they're obviously video consulting in with a specialist at the other end. Now, for a lot of residential aged care facilities, it's actually going to be up to the GPs and the specialists to educate them about what's happening and what's available to them, because most of them kind of go, oh God, that just sounds really hard. They don't have great technology as part of their facilities either. So sometimes it's a matter of saying, we can bring a laptop, we can bring an iPad and actually facilitate that. So for residential aged care facilities, the big bonus for them is as soon as they've held their first telehealth video consultation, they can actually receive a lump sum payment of $4,800. On the 1st of July, that does reduce to $3,900, but unlike GPs and specialists, they don't need to conduct 10 to get that full payment. So once they've done their first one, bam, the money's theirs, and it's there that they can invest in increasing the technology to make the services more readily available. The other thing too with residential aged care is that they do get a per patient incentive as well. So for each video consultation that they conduct, it's $48, and as of the 1st of July, that goes down to $39. And as I said, they just need to host at least one consultation. They do need to be an accredited facility with human services, and they just need to apply for those benefits. So if you are, or your GPs, or you've got specialists that are consulting residential aged care, have a chat to your facilities and let them know that those incentives are available, because I pretty much guarantee that they actually don't know that. And once again, it's a really good opportunity to improve care for people who aren't able to make those trips. So the next thing I'm going to talk about is Skype. So Skype has been a little bit of a contentious issue on and off, and the college has actually put out our recommendations for Skype, which you can download from our website. So it's kind of like a 3 or 4 page document that goes through using it. At the moment, there's nothing to say that it's not clinically appropriate to use Skype, and it is a really great way of dipping your toe into telehealth, because you don't have to pay anything for it and you don't have to invest in a lot of infrastructure. And Skype's something that people are familiar with. Like, I'm sure all of you have probably Skyped, a friend or a family member travelling overseas. So there's not a lot of learning that needs to be involved in that as well. A couple of things that we do recommend though when you're thinking about using Skype. The first thing is it's an open directory with over 6 million users. So you're going to want to have a username that's got a little bit of anonymity around it. So you wouldn't be going, hey, I'm Dr. Joanne, because that's going to potentially generate a lot of unwanted contacts and attention. The other thing that you're going to need to do is, if you've got any medical content, images, documents that need to be shared as part of the consultation, don't send them through Skype. The reason being is that with your Skype call, what will happen is that part of the call will go through servers that are actually not based here in Australia, and they'll be in countries that have different privacy laws, and it will mean that people may have an easier way of accessing those documents. Your video and your audio content's fine, but it's just that documentation and those images. So just send them an email through an encrypted email server, or use something else that's encrypted and safe, either prior to the consultation or after the consultation. And don't expect any technical support. Skype is great, and 9 times out of 10 it will work, and it will work okay. They've got some great FAQs on their website, but there's no one there that can help you if it doesn't work. So make sure you've got a backup plan. And once again, using Skype for your video and the phone for your audio is often a really good way to get around any technical issues that you're having. So what resources do we have? We've got quite a number of resources. Obviously, we've got our standards for general practice who are offering video consultations. And last year we released a new edition of our implementation guidelines. Now, I'm going to say this really is your one-stop shop. It tells you everything you need to know about the MBS item numbers, your eligibility. It talks about hardware and software considerations, and the appendices actually provide some information on the popular software and hardware options. It talks about security and privacy, your minimum bandwidths, which Leslie did touch on. So if you're looking at this, you really can't go wrong in terms of your implementation. We also have quite a lot of templates that you can download to help you facilitate and manage your workflow. So we've got the patient information brochure, got a booking checklist so you can tick things off to make sure everything's in place for the day. Engaging with specialists, that can sometimes be really difficult. So what we've done is that we've actually put an introductory letter on the website that you can send to specialists. When you're engaging with specialists, or when you're wanting to get specialists on board, your best bet is to look at the ones that you're referring to as part of your normal practices anyway, because they're the group that you've got and that you've got that relationship with. And obviously, a simple phone call may be enough to get the process started, but the letter outlines what the benefits to the specialists are, because sometimes you've got to sell stuff to make people want to be involved in it. So if you let them know what's in it for them, they might be a little bit more willing to come on board and help you out as part of that video consultation process. And we've got an evaluation tool. You need to know how successful your consultations are and how successful you've been, and the only way to do that is to get that feedback. We've also got some fact sheets and advice that basically take this into a nice 2 or 3 page document, and we've got an etiquette fact sheet and obviously our Skype advice that you can check out. We also have some online education if you want to take it to the whole new level in terms of getting your details and finding out about telehealth. It's a 6-hour online component, but what we've done is we've broken it down into sections that cover MBS item numbers, business viability, information on getting started, and they take around about 45 minutes to complete. So if you don't need information on everything, you can just go in and actually do the specific bits that are relevant to you. You don't have to be an RACGP member to access that. It is free of charge. Just visit our GP learning site and you can sign up for a free account and jump straight into the active learning module. If you do decide to do the whole 6 hours, you're obviously eligible for your 40 Category 1 points, so that's quite a good one as well. The most recent document that we've released is our guidelines for interprofessional collaboration between general practitioners and other medical specialists providing video consultations. So it's got the longest title of any publication I've ever seen, and no, that wasn't my fault. But this is really something that's great for GPs and specialists. We've actually worked with a number of specialist colleges in putting this together. And it talks about what's needed at both ends of the consultation. So not only will this give you advice on how to run your consultation, but once again, it's a really good sell for your specialist. You know, when you're sending them the letter, send them a copy of this and say, hey, this is what you'll need to do. It's a really brief, concise document, and it's got a really great diagram checklist that says exactly what's going to happen at both ends of the consultation from a specialist and GP perspective. They're also a really good community reference for your patients because they will tell patients what they can expect and what benefits they'll get from telehealth as well. So resources coming soon. The most important thing and one of the big barriers that we're finding is that there's not a single directory of telehealth providers. There's a lot of niche directories. Akron's directory is fantastic. We've also got different software providers, and obviously the Medicare locals are providing their own directories in their specific areas. As of not next week but the week after, so the week beginning sort of like the 13th or the 14th of May, we'll actually be releasing a national telehealth directory. We've been working with the National Health Services Directory, who already have quite a number of listings in the directory itself. For example, they've got about 98% of general practice services listed. So we'll be working with them to get people to join the directory and actually tick themselves or advertise that they are a telehealth service provider. And you'll be able to access that via the RACGP website. And it won't be restricted, so once again, you're not going to have to be an RACGP member to access that. You'll be able to go in as a practice nurse, a specialist or a GP and look up people who are in your area or who are offering telehealth. There's probably only about 500 records in there at the moment, so we're doing a really big push to get people signed up. So if you're doing telehealth at the moment, in the next couple of weeks, please sign up. We're also running a competition because that gets people involved, so there's a chance to win one of 10 iPads. So that'll also help you with telehealth because you'll have something portable to take around with you. So that's pretty much it for me. We've obviously got our telehealth support service. You can contact us via email, via telephone number, and obviously visit our website because we do have quite a lot of really good resources there. Any questions?
With the service directory,
yes. Perfect.
We've already got service directories for patient e-journey and specialist e-journey.
Yes.
Will they be automatically up in that service directory, or is every email going to have to contact? Because we've got quite an extensive list already.
See, that's what I like to hear, an extensive list. The NHSD has actually been working really closely with the Medicare locals, so I'm assuming you're one that they've been working with to actually get that information from you to then put into the directory. Yeah, please do. And if not, just, give us a call and we can point you in the right direction because the NHSD has already collected a substantial amount of information from the MLs to actually add to the directory. So it should already be there or close to being there. Excellent. Anything else? No? Thanks, everyone.